It has moved to alert level 4, the nation's second highest from level 3, with effect from midnight on Sunday. And the restrictions will remain for 14 days. This after President Ramaphosa addressed the nation last night, pleading with the nation that tough measures were needed to combat the Delta variant of COVID-19. Other restrictions also include limiting travel to and from Gauteng, the nation's commercial hub, has been hardest hit by a third wave of COVID-19 cases. For more on this, we're joined by world-renowned public health expert, Professor Salim Abdool Karim of CAPRISA. A very good evening to you, Prof. Thank you so much for speaking to us. I mean, I'd like to hear from you. You've been studying this from the very onset, COVID-19. Are you surprised that we are where we are, considering the fact that there's been criticism by some saying too little, too late?
It's a very complicated thing, and a very good evening to you, Sipiso, and all of the viewers. When we were looking at this current third wave, all our evidence at that point was that we were still dealing with the beta variant. And as long as we were dealing with the beta variant, we had some idea of where the situation was and what we can expect, because we already had the beta variant in the second wave. However, what we have seen now is that over the last 2 to 3 weeks, the Delta variant has now displaced the beta variant. And that means that the situation is now very different. We are now dealing with a much more transmissible virus. And when we think about the second wave, and if we want to think about what's going to happen in the third wave, it is going to be much worse, because the number of cases are going to be higher. The speed at which the new cases occur will be substantially higher, because remember, the Delta variant is able to transmit much faster. There's just a mutation at a critical point in this virus, right where the furin cleaves the virus itself, enable it to attach to the cells. That's what enables it to really spread very fast from person to person. So that's what we have to prepare for. Now that we know, and I was among the first to know this information, I only learned about it at 11 a.m. on Friday. And as soon as I heard about it at 11 a.m. on Friday, I knew we were in trouble and we needed to now take more drastic action, because now we're dealing with a different situation than we were while we were dealing with the beta variant.
And Prof, you've been in discussions even at the World Health Organization Africa level, where there's been discussion on comparisons of COVID-19 here on the continent and elsewhere. So given the fact that the Delta variant is present in more than 50 countries, tell me about, is information being shared quickly enough? And is there a way of identifying how it moves, where it's favorable for it to arrive, so to speak?
Yeah, so we have the coronavirus, the African Task Force for Coronavirus, and that group has individuals from various countries. And we meet on a regular basis under the auspices of the African CDC. I also chair one of the African CDC's committees under the African Union, where we are continually monitoring the situation. I think our big challenge is that South Africa has, a very advanced capability in doing genetic sequencing of the viruses. And so we can keep track of where the viruses are, what new viruses are emerging, and we can do so quite quickly. But even we were about 3 weeks behind schedule in terms of doing the genome sequencing, because it's so much of hard work and it's a lot of work. So in the rest of the continent, they depend quite a lot on the data we generate. There's a second group in Nigeria that also generates this data, and there are a few other groups. But really, most of the data comes from South Africa. So in many ways, the rest of Africa is sort of learning in that what we are discovering is helpful to them. In some instances, we have seen in some of the epidemics, for example, in Uganda, where the Delta variant is now spreading quite rapidly, and they have been describing the epidemic over the last 2 weeks or so, what we have seen is a change in the age profile. And when we look at South Africa's age profile of COVID patients, similarly, it's changing. It's changing in that the number of children becoming infected is going up. Now, children still have a very low risk of COVID-19, but that risk is slightly higher now with COVID, with the Delta variant than we've seen elsewhere. So these are just giving you an example of how we are learning from each other. We're watching what is happening in other countries, and we're benefiting from that in South Africa.
All right, Prof, let's talk about the differences. I mean, you've mentioned it also, but I know Delta is more transmissible, as you've mentioned, but just so that we understand, how many variants do we have now of COVID-19 not only present in South Africa? And if you can also talk about how many times the virus itself has mutated.
Sure. So right now, in the World Health Organization has classified 4 viruses as what are called variants of concern. These are variants that are either causing, are spreading faster or able to escape immunity. So, these 4 variants, and they are Alpha, the one that was first described in Britain, Beta, which is the one that we've described in the Eastern Cape initially in December last year. We've got Gamma, which comes from Brazil, which was described in January. And then we've got Delta. And Delta was first described in India on the 25th of March. So just think about it. So we only known about Delta variant since the 25th of March. That's less than 2 months, or just about 2 months. And even when we first heard about it, to do the research that's required takes quite a bit of time. Now, let's look at what is it we know about the Delta variant. And we want to really answer 4 key questions, and I'll try and do so quickly. The first is it more transmissible? The answer to that question is undoubtedly yes. There are 3 studies that show this. The studies in the UK are probably the most compelling, that show that it's somewhere around 40 to 60% more transmissible. You can look at it in various ways. For example, when they compared it in a European survey, it was about 97% more transmissible. So that translates into about double the speed at which it's transmissible. The second is it more severe? And it's difficult to determine that at this stage, too early. Doesn't look like it's more severe, but we need definitive evidence still to come. The third, does it escape natural immunity? The answer is yes, in some instances. And in our case, people who were infected with the Beta variant in the second wave are not protected against the Delta variant. There is only very partial protection. And so there's a good likelihood that if you get exposed to the Delta variant, even though you were infected in the second wave, you'll get in reinfection right now. And then finally, we want to know, does it escape vaccine immunity? At this stage, the evidence is quite good, and it suggests that the virus is not escaping vaccine immunity against the vaccines we've already tested. There's no evidence for us to be concerned about at this stage, but it's something that needs a lot more research.
Okay. Prof, quick and final question. Given the fact that we are learning all of these new things as we go along, is modeling still valuable to us if we can't really predict what's going to happen next?
Modeling is just it as an indication. I think some people take modeling as, that's what's going to happen. It's just an indication of what may happen under certain assumptions. Often those assumptions change, the situation changes. But what it does do, which I find to be helpful, is that it gives you a range. So if the reproductive rate of infection, what we call the R0, if it's at this level, this is the peak we're likely to see, this is how long it will last. If the R0 changes, as it is with the Delta variant, where the R0 is now higher, we will expect to see a different peak. So it gives you some indications, but one mustn't take it too seriously. It's more as a guide for our planning purposes.
All right. Thank you so much for speaking to us. It was a pleasure. Thank you so much, Professor Salim Karim. He is a world-renowned public health expert who is with CAPRISA. And of course, later on, we'll zero in on Gauteng and see what the local COVID-19 committee is saying about what it foresees for the next 14 days.